The July 19th, 2016 meeting of the Human Services Committee, excuse me, will now come to order. Will the clerk please call the roll?
Mrs. Brown? Here. Dr. Carbone? Here. Mrs. Conley? Here. Mrs. Draw? Here. Ms. Harris? Here. Mr. Hebert? Here. Ms. Cayley? Here. Mr. Lightfoot? Here. Chairwoman Taylor?
Here. Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? Being none, next item on the agenda is the approval of minutes. You have the June 28, 2016 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. I just want to take a minute. It looks like we have some new faces at the table. So if you would like to introduce yourselves, we would appreciate that.
Mike Molinari, Assistant County Executive.
Good evening, Bob Franklin, Monroe County CFO.
Kathy Cardelli, Administrator with Department of Human Services.
Dr. Nadia Granger, Medical Examiner.
Mary Young, Manager of Nursing Services.
Frank Marabella from the Health Department.
Neha Stowe, Law Department.
Thank you. I'd like to welcome you all. The next item on the agenda is new business. Madam Clerk.
Referral 16-0228.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Legislator Cayley?
Thank you, Madam Chair. Through you to the administration. This mentions the CPS staff to client ratio for Monroe County to maintaining it. Can you tell me if it's a recommended staff to client ratio or if it's mandated?
Through the speaker, the recommendation is for each caseworker to have 15 or below cases.
Thank you.
Any other discussion?
Yeah, sorry.
Oh,
I'm sorry.
Legislator Cayley?
My notes were written in
I
very
thought you had more,
small
but
font. Very small font. My glasses are not quite strong enough. Yeah, one last question. Thank you, Madam Chair. Is there any particular reason, it states that this is the 6th year, but obviously it's not consecutive years because we didn't receive anything in 14 or 15. Was there any particular reason for not receiving those funds during those 2 years?
Madam Chair, actually, those years were not brought as a referral to this body because the funding was already included in the annual operating budget.
Thank you. Then if I understand you correctly through the chair, the funding of the previous years was not included in the budget?
Madam Chair, when a grant is included in the annual operating budget, there's really no need for a separate referral to accept that funding. This year, 2016, the dollar amount is not in the operating grant budget. Therefore, a referral to accept that funding and to amend the budget is required.
All right, thank you. I understand.
Is there any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? The item carries. Next item.
Referral 16-0229.
Moved by Legislator Conley, seconded by Legislator Draw. Is there any discussion? Legislator Lightfoot?
Thank you, Madam Chair. Through you, Madam Chair, to the administration, what public health activities has the Department of Health staff and the U of R provided in the community? What type of programs have you done?
Through the chair, for the last 3 years, in coordination with the University of Rochester, we have provided increasing presence, providing influenza vaccine in the schools throughout the county.
I'm sorry, to you, Madam Chair. The increased presentations or presents? I didn't.
I'm sorry, through the chair, we have increased the number of students we have actually physically immunized in the schools.
Oh, okay. Okay, great. Thank you so much for that. Through you, Madam Chair, how do you determine where to go to these schools, or reach the, how do you determine where to go?
Through the chair, that is determined by the University of Rochester's research study grant that funds are providing the services. This year, we will be expanding to twice as many schools, which will include all the city schools and 4 suburban school districts.
Okay, thank you so much.
Any other discussion? Legislator Cayley?
Thank you, Madam Chair. Through you to the administration, whether or not you have this with you, I can certainly take an answer at a later date, but do you have an idea of the percentage increase that you've been able to affect in terms of immunizations? Obviously, my concern would be within the city schools, but I think countywide.
Through the chair, I can provide you with that exact data, as it's about to be published in the American Academy of Pediatrics for the efficacy of the program. Last year, we personally immunized just under 1,400 students, but the study was able to demonstrate through review of records through New York State Immunization that public health detailing, the encouragement of parents to immunize their students, changed the rate of immunization in the schools that participated compared to the schools that had no intervention. And I can get you that exact detail once they give me permission to release you the document.
That would be great. Thank you very much.
It's due to be published in the next couple months.
Great.
Is there any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 16-0230, amend
Moved by Legislator Carbone, seconded by Legislator Draw. Is there any discussion? Legislator Harris?
Thank you very much, Madam Chair. Madam Chair, through the chair to the administration, is there ever a plan to fill these positions with a permanent pathologist?
Through the chair, I believe the legislator's on the wrong referral.
Oh,
We're on 230.
oh, 230, I'm sorry, forgive me. I have a question for that one as well. Through the chair, through the chair to the administration, does this grant, actually, the total grant is $4,548,961 is slated to identify and safely remove correct lead hazards in housing. What other things is this funding covered? Does it cover anything with marketing and awareness for lead poisoning? It's very hard to read this. It's very small today.
Yes, through the chair. It doesn't fund any specific marketing campaigns, but it can be used for our educational materials that we do distribute in the program. We have produced DVDs for distribution. We also purchase a lot of educational materials that are used in health fairs and educational events that we do throughout the year.
Okay, thank you. How is housing, through the chair to the administration, how is housing identified for correction, and how many properties have been identified in the county with as lead hazard?
Yes, through the chair, we target our properties through a variety of referrals. We do receive all the blood lead tests for any child that's tested in Monroe County, and we respond based on the level. So a portion of our referrals are through, direct blood lead testing results that we receive. Then we also have several other target groups that we reach out to. We have a refugee program where we target housing for new refugees that are coming into Monroe County. We also have a pilot project that we work with the Department of Human Services to identify housing for people receiving their services, and we do inspections for them as well.
Thank you very much. That would conclude my questions for that.
Legislator Kaley?
Thank you, Madam Chair. It's been, the effort in Monroe County has been stellar with the reduction in lead poisoning in children, and I'm always pleased to hear the figures. When will we know what, or I'd say had they been published, I don't believe that I know, up to 2015 what the levels have been? Are they as low as they have been, or has there been an uptick? There have been a couple like blips up and down. So I'm looking for, and if it's not ready yet, I'm okay, what those levels are measuring out at.
Through the chair, yes, actually we did just release the 2015 blood lead testing data. There were some categories that showed a slight uptick in the 5 to 9 microgram per deciliter range, but the majority of the higher levels had seen a decrease. But we are seeing that from year to year that some of the levels or some of the categories may go up very slightly and others go down slightly.
Thank you.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item?
Referral 16-0231.
Moved by Legislator Draw, seconded by Legislator Hebert. Is there any discussion? Legislator Harris?
The correct one. Last year, I noticed that you guys brought the contract out during search for 2 full-time forensic pathologists, and this year I'm wondering, is there any plan in the future to fulfill this in the future with a permanent pathologist? Through the chair, I'm sorry. To the administration.
We've actually recently hired, effective July 11th, a full-time forensic pathologist for our office. We are currently in the midst of hopefully positively getting a result from another forensic pathologist to join our office sometime in September. That will bring our number to 3 of 4.
Thank you very much.
Legislator Lightfoot?
Through you, Madam Chair, to the administration, can you tell me, please, what a forensic pathologist is?
Sure. Through the chair, a forensic pathologist is a physician who is board certified, at least per our request, with specialties in pathology, specifically forensic pathology. It's the study of sudden and unexpected deaths.
So it's the study of sudden deaths. So here in this referral, I see that there's a request to do for some contracted services through you, Madam Chair, and I just so happened to stumble across the backside, and it looks like these contracted folks here in attachment A are out of town. They live out of town. They have out of town addresses. So through you, Madam Chair, can you tell me how that works?
Through the chair, the contract was completed with the approval of the administration. The bid was put out, and the respondents that we did receive did happen to come from New York City within the state, which means that they do have New York State license, which allow them to practice through our office.
Right, so thank you for, but through you, Madam Chair, I'm still not satisfied. How do they complete their job in forensics here in Monroe County if they're out of state? Do they come in town for a weekend, or I mean, I'm just trying to understand. Madam Chair.
Through the chair, once they have agreed to fulfill their contract with our office, they self-transport, whether it be fly or drive, to Rochester, where they will perform the autopsies and other studies that are associated with the examination. At that point, they will complete a preliminary report. Any additional work to be done on that particular case is either done through mail services or on their next return to the office. I think it's really important for us to mention that our aim within the office is to get to a point where we have enough forensic pathologists who are on staff with our office that we will no longer need contract physicians, but in the meantime, it is necessary for us to perform the duties and actually serve the community.
I have no further questions. Thank you.
Legislator Cayley, excuse me.
Sorry, just quickly, I understand the process and the time constraints, and it is really good news that we have upwards to 2 people coming on. I'm sure that that is a relief for everyone. But just bear with me. We have, what, 10 contract physicians. When you have a need, is it pulling a name? Is it as simple as just going down the list and seeing who's available? Or is there a method to picking one of any of the candidates that have agreed to contract with us?
Through the chair, we work with the contracted physicians to identify a time when they will be available to come to our office to serve that purpose.
Okay, thank you. That's it.
Legislator Conley?
Thank you, Madam Chair, and to the administration through the chair. If the contract physicians actually have to testify at a hearing or at a trial, is the travel back and forth and the appearance for the
Legislator, would you pull up the mic a little tiny?
Thank you.
Thank you.
Is the travel and the time required for testimony, is that part of the contract?
Through the chair, it's been fortunate and also through specific plans that the cases that are performed by the contract physicians are not those that will require testimony in the future. Should that occur, the physician will then either be transported back to our office, or one of the local forensic pathologists will testify on their behalf.
Thank you.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 16-0232,
Moved by Legislator Hebert, second by Legislator Brown. Is there any discussion? Legislator Cayley?
Thank you, Madam Chair. Through you to the administration. Could this is specifically just Monroe County?
Through the chair, yes.
Thank
It
you.
would only be Monroe County.
And then, if you don't mind, through the chair, could you just, when you say that it is for control and the related costs, I understand post-rabies exposure, but I don't think that I quite understand where the pre-works starts? Could you explain that for me?
Yes, through the chair. The funding can be used for any of the costs incurred in rabies suppression in Monroe County. So we would be allowed to use it for vaccine for the rabies clinics that we give out. That we could use it for submission of samples for testing to determine whether an exposed person was potentially bitten by a rabid animal. But the majority of our funding really does go for the post-exposure prophylaxis because that is the major expense that we incur here.
All right, thank you. And if I'm correct, through the chair to the administration, the treatment for post-exposure is much different than what most of us remember and feared in the past. Am I correct?
Yes, you are correct. At one point, they were giving abdominal injections, and that doesn't happen anymore.
Thank you very much.
Sure.
Any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item?
Referral 16-0233.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee? Being none, thank you, Legislator Lightfoot. The July 19th, 2016 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, August 23rd, 2016 at 5:30 p.m.